Clinical notes contain some of the most important prognostic information in any hospital. Doctors write detailed observations about tumor characteristics, treatment responses, and patient history in free text paragraphs. But here is the frustrating part. All of that rich information is trapped. No algorithm can read it at scale, so it sits there, practically invisible to computational analysis. This paper evaluates a privacy-preserving large language model, an LLM, designed to extract prognostic data from unstructured clinical notes in head and neck oncology. The key phrase here is privacy-preserving. This model runs locally on hospital infrastructure, not in the cloud. Patient data never leaves the building. That distinction matters enormously for hospital adoption. Oncologists validated every extraction the model produced against their own manual chart review. The LLM reliably extracted complex prognostic variables like tumor staging, treatment history, and outcomes data. Let me put this in clinical perspective. Head and neck cancer involves intricate anatomical subsites and staging systems. Extracting this information from free text requires genuine medical understanding, not just pattern matching. Here is why this matters beyond oncology. Unstructured clinical notes are the single richest source of patient information in any hospital, richer than structured electronic health records. But they are locked in free text format that traditional databases cannot process. Large language models can bridge that gap, turning narrative text into structured data that researchers and clinicians can actually analyze and use for treatment planning. The caveat you should know about: this is a retrospective evaluation. The researchers tested the model on existing clinical notes, not in real time during patient care. Real deployment introduces challenges this study does not address, including latency when a doctor needs answers quickly, error handling when the model encounters unusual language, and integration into existing clinical workflows that are already stretched thin. If translating AI research into clinical insights is useful to you, like and subscribe. We break down papers like this every single day, focusing on what matters for actual patient care and clinical workflows. The full episode with all the technical details is on the channel.